think for a moment about all the ways you're taking in the world right now.
Yeah.
The screen you're looking at, maybe the sounds around you, the feel of the air.
Right, our senses. Sight, hearing, touch, smell, taste. They're constantly working.
Exactly. But it's more than just those five, isn't it? There's also, like, knowing where your body is, kinesthesia.
Yeah, kinesthesia. And stereognosis, that's recognizing something just by touch, its shape and texture. Really quite amazing when you stop to think about it.
It really is.
Yeah.
And this whole stream of input, it's how we understand everything.
Precisely. So what happens when that gets messed up, disrupted? Maybe too little information, maybe way too much, or it's just processed differently.
Yeah, that's exactly what we're diving into today, sensory alterations. We have some really interesting material here looking at these changes, especially in healthcare settings.
And we've got a case study too, right? Miss Long.
Yes, Miss Long, she's 70, dealing with a cataract. It gives a very personal angle on it.
So the goal is to really get a handle on how these shifts affect people, the different types: deficit, deprivation, overload.
Right, and what causes them, and maybe most importantly, what can actually be done to help.
Hopefully this will give you, the listener, a clearer picture, because these experiences are pretty common, actually. You might even recognize some things yourself or in people you know.
Okay, so where do we start? Maybe with how sensation normally works.
Good idea. So fundamentally, it's a 3-step thing: reception, perception, and reaction.
Reception. That's like the stimulus hitting the sensor. Light on the eye, sound in the ear.
Exactly. Then perception. That's your brain becoming aware, making sense of it. Interpretation, really.
And finally, reaction, how you respond.
Right. And, our nervous system is just flooded with this stuff constantly.
But our brain filters it, thankfully. It's like an editor.
A very efficient one. And there's that adaptability thing, too, like background noise. After a while, you just don't consciously notice it anymore.
Yeah, the fridge hum disappears.
Precisely. But what's really fascinating is how this system can get disrupted that leads to these sensory alterations.
And the text we're using highlights 3 main kinds.
That's right. Sensory deficits, sensory deprivation, and sensory overload. And it's important to note, someone can experience more than one at the same time.
Which must make things even more challenging.
Definitely. It can really impact daily life, how they connect with the world.
Okay, let's unpack sensory deficits first. What does that mean exactly?
So a deficit is basically an impairment. Either the body isn't receiving the sensory info correctly, or the brain isn't processing it right.
Like losing some vision or hearing.
Exactly. And when that happens, people might, understandably, start to withdraw a bit.
Yeah, maybe avoid situations where they feel it'll be obvious or communication gets hard.
Right. Which can sadly lead to isolation.
But people adapt, don't they?
Oh, absolutely. They find ways to cope, to compensate. Sometimes if one sense weakens, others might actually get stronger, more acute.
Like someone who's blind developing really sharp hearing.
That's the classic example. But coping can also involve behavioral changes. Some helpful, like turning your good ear towards someone. Others less so, like avoiding parties out of embarrassment.
So it's not just the physical loss, it's the ripple effect.
Exactly. That link between the sensory loss and potential isolation is really key to recognize if we want to help effectively.
The text gives some common examples for vision, right? Like presbyopia.
Ah, yes, presbyopia. The joys of aging. Difficulty focusing up close. Happens to many of us.
Tell me about it. And cataracts, like Miss Long.
Right, the cloudy lens.
Yeah.
It causes blurry vision, problems with glare. Very common, too.
And what about computer vision syndrome? Digital eye strain. Is that really a sensory deficit?
Well, it's listed here. It certainly affects how well you see after staring at a screen all day. Dry eyes often go along with it, too.
Makes sense. What else for vision?
Glaucoma, that's increased pressure in the eye. It can cause peripheral vision loss over time.
And the text mentions something about prevalence.
Yes, it notes a higher prevalence of glaucoma-related issues in African Americans. It highlights how things like access to care and maybe even genetic factors can play a role in who's affected.
That's important context.
Definitely. Then there's diabetic retinopathy, affecting blood vessels in the retina, and macular degeneration, which hits your central vision.
Okay, moving to hearing. Presbycusis.
That's the age-related hearing loss, very common as well.
And just earwax, cerumen accumulation.
Yep. Believe it or not, simple earwax buildup can cause conduction deafness. Significant impact from something seemingly small.
Wow. Okay, what about other senses?
The text also mentions balance deficits leading to dizziness, feeling unsteady, pace deficits too, sometimes linked to dry mouth or xerostomia,
Right.
and neurological issues, things like peripheral neuropathy, that numbness and tingling. It affects touch, but also proprioception.
Proprioception, that's the body awareness set.
Yeah, your internal GPS for your limbs. And stroke, depending on where it happens in the brain, can cause all sorts of sensory changes like visual spatial problems or altered body awareness.
Okay, so that covers deficits, a lack or problem with the senses. What about sensory deprivation?
Right, deprivation is kind of the opposite problem in a way. It's when you get too little sensory input.
Too little. How does that happen?
Well, it could be a simple reduction in the amount of stimuli, or the stimuli you do get are meaningless, repetitive, or you're just in a very restrictive environment leading to monotony.
Okay.
Our brains actually need a certain amount and quality of stimulation to stay alert and function well. There's a part called the reticular activating system, RAS. Think of it as the brain's on switch.
So if the RES doesn't get enough input, problems.
Exactly. It needs that stimulation. If it drops too low, you can see effects across different areas.
Like what kind of effects?
Cognitively, things like reduced learning ability, trouble problem solving, maybe feeling disoriented, even some odd thoughts. Effectively emotionally, maybe boredom, restlessness, anxiety ramps up, even depression. People might crave physical contact more.
And perceptually?
Yeah, changes there too. Reduced coordination, maybe changes in how you perceive colors, or even your sense of time and space feeling off.
Wow. That's quite a range. And you can see how maybe a hospital setting could contribute to that.
Absolutely. Unfamiliar surroundings, maybe less social contact, limited mobility. It can inadvertently create an environment ripe for sensory deprivation.
Are there other sort of everyday situations where this might happen outside of a hospital?
Oh, sure. Think about prolonged isolation, perhaps an elderly person living alone with very little interaction, or someone in a very unchanging, quiet, dimly lit environment for long periods. The effects, trouble concentrating, anxiety, low mood, could definitely show up there too.
Right. Okay, so we've done deficits, deprivation.
Right.
What about the third one? Sensory overload.
Sensory overload, yeah. This is when there's just too much coming in, too many stimuli hitting you at once, and the brain just can't process it all effectively.
It gets overwhelmed, can't filter.
Exactly. You can't disregard the less important stuff. And interestingly, being bombarded like that can sometimes lead to a state that feels a lot like deprivation. You kind of shut down or feel disconnected.
That's a really key point. So it's not just unpleasant, it can actually impair function.
Definitely.
What are the signs? How would you know someone's overloaded?
You might see racing thoughts, difficulty focusing, restlessness, agitation, anxiety.
You might seem scattered. Sounds pretty awful.
It can be. They might find it really hard to concentrate, maybe even start doing repetitive actions or try to physically block things out, like covering their ears or eyes.
Who's most at risk for this?
Well, people who are acutely ill are definitely vulnerable, especially, say, in an ICU setting.
Oh, yeah, the lights, the alarms, people coming and going.
Constant barrage. Also, people in significant pain or those needing frequent checks and procedures. Even just having multiple people talking to you at once can tip someone over the edge if they're already struggling.
Makes sense. So we've got the types. Deficit, deprivation, overload. What makes someone more likely to experience these? What are the contributing factors?
There are several big ones. Age is definitely a major factor.
We talked about presbyopia and presbycusis.
Right, and those changes are gradual usually. Vision changes often start becoming noticeable, say 40s, 50s. Besides focus issues, the cornea might flatten a bit, risk of glaucoma goes up. Older adults might also find their visual field narrows, they become more sensitive to glare, night vision isn't as good, and depth perception and even color perception can change.
And you mentioned hearing changes can start even earlier, around 30.
Yeah, difficulty with high-frequency sounds often starts then, and understanding speech in noisy places can get harder.
What about taste and smell?
Those tend to decline a bit later, maybe more noticeable around age 50. Fewer taste buds, fewer sensory cells in the nose.
And touch. Body awareness.
Proprioception and touch sensitivity can change too, often after 60. This can affect balance, coordination, how sensitive you are to pain or temperature.
It's quite concerning that these normal age-related changes could be mistaken for something like dementia.
It really is. It underscores how important careful assessment is, especially in older adults. Don't just jump to conclusions.
Okay, so age is huge. What else influences sensory function?
Well, the meaningfulness of stimuli is really important, especially for preventing deprivation.
Like having familiar things around, pets, photos.
Exactly. Those things provide connection, comfort, stimulation. Think about a hospital room versus home. Even having a roommate in a shared room can be positive stimulation or sometimes negative, depending.
Sure. And the sheer amount of stimuli matters too, right? Too much leads to overload.
Right. We covered that. Think about the frequency of care in an acute setting, constant noise. It adds up.
Social interaction.
Hugely important, both the quantity and, maybe more importantly, the quality of social contact. Isolation is really detrimental.
And our environment. Jobs, surroundings.
Definitely. Occupational hazards are a big one. Factory noise causing hearing loss, welding risks for eyes.
Even desk jobs. Carpal tunnel.
Yeah, repetitive movements affecting touch sensation. And healthcare settings themselves, sometimes things like being immobilized for long periods or isolation for medical reasons, can unintentionally cause sensory issues.
The text also brought up cultural factors. That seems really crucial.
It absolutely is. We need to be aware of potential disparities. We mentioned glaucoma being more prevalent in African Americans. Data also suggests higher rates of blindness or visual impairment in children as teens who are African American or identify with two or more races.
And that has knock-on effects.
Big time. It can impact physical health, mental health, even things like health literacy, understanding health information, and navigating the system.
Access to care is part of that too.
Yes, the text mentions survey data showing differences in access to eye exams and glasses based on race and socioeconomic status. It's a complex picture.
It really is.
Okay.
Let's bring this back to Mrs. Long's case. Diliana, the nursing student, was applying this knowledge. What was her initial thinking?
Well, Diliana saw the cataract, factored in Miss Long's age, and thought about the potential ripple effects, not just the vision change itself, but emotional, maybe even cognitive impacts.
She anticipated the blurriness making things difficult. Reading, maybe hobbies.
Exactly. And she was right. Miss Long reported exactly that blurry vision near and far, difficulty reading, trouble seeing at night.
He was scared.
Very scared of falling, especially on her stairs. She also mentioned feeling embarrassed, having trouble concentrating, and even sleeping poorly.
Wow. It was really affecting her whole life.
Absolutely. Her sense of safety, her confidence, her daily routines.
And Diliana did a home assessment. What did she find?
Yeah, based on Mrs. Long's description and her own understanding of risks, like thinking about her own grandmother, she looked for hazards. She found throw rugs, some worn carpet with curled edges, and the lighting was generally quite dim.
Classic fall risks, especially with impaired vision.
Textbook examples.
So based on all this, Diliana identified some specific nursing diagnoses.
Yes, the key ones were risk for injury and risk for fall, directly linked to the vision impairment and the home hazards.
Okay.
But also fear, tied to her worry about falling and vision getting worse, and anxiety connected to the restlessness, difficulty concentrating, poor sleep, she described.
That's a really holistic view. Not just the eyes, but the whole person.
Exactly. It shows how a sensory deficit isn't just a physical problem.
So what was the plan? What interventions did Diliana suggest?
Well, they focused on those diagnoses. For safety, recommend removing the rugs, improving the lighting. Really practical stuff.
Makes sense.
Also, strongly encourage her to see an ophthalmologist about the cataract itself, and then provide emotional support, work on strategies to manage the fear and anxiety.
And did they see any early positive results?
Yes, actually. After Miss Long removed the rugs and they changed some light bulbs to brighter ones, she reported no falls in that initial period.
That must have been a relief for her.
Huge relief, I imagine. That early win probably helped ease some immediate fears.
It really shows how targeted interventions, based on understanding the sensory alteration, can make a real difference.
Absolutely.
Okay, zooming out again. Thinking broadly about prevention and management, what are the key strategies?
Prevention is always the best approach where possible. So, health promotion is big educating people about risks, encouraging regular screenings.
Like eye exams?
Right. Recommended for newborns, kids at various stages, annually for diabetics, more often for those at high risk for glaucoma, like African Americans or those with a family history.
And hearing tests.
Yep, periodic tests throughout life.
Boy.
More frequently as you age, or if you work in noisy places annually then.
What about specific actions people can take day to day?
Definitely. Eye safety is crucial goggles, face shields for sports or work, For hearing, limit loud music exposure, use earplugs or earmuffs in noisy environments.
Vaccinations, how do they help?
Some diseases preventable by vaccine can cause hearing loss, so stay up to date helps. Also, being cautious with certain medications, ototoxic drugs that can damage hearing. And for screen time. The 20-20-20 rule helps with digital eye strain.
Remind me.
Every 20 minutes, take a 20-second break, look at something 20 feet away, gives your eyes a rest.
Good tip. What about assistive devices? Glasses, hearing aids?
Essential for many. Glasses and contacts need proper care cleaning, handling to work well, and avoid infection.
And hearing aids?
They can be life-changing, but the text notes some reluctance sometimes, especially among older adults. Cost, appearance, maintenance can be barriers.
So family support is important there.
Very important. Helping with cleaning, making sure batteries are charged, just encouraging consistent use.
Okay, beyond devices, how can we promote meaningful stimulation for someone with alterations? Modify the environment.
Exactly. For vision loss, think brighter lighting, but minimize glare. That's key. Use shades, maybe amber lenses. High contrast colors help too, like a dark plate on a light placemat.
And for hearing?
Amplifying sounds where needed, maybe using pocket talkers, speaking clearly in a lower pitch sometimes helps. Facing the person directly.
What about taste and smell?
Good oral hygiene can enhance taste. Using pleasant aromas, baking bread, flowers can stimulate smell and appetite.
And touch.
Providing opportunities for safe, comforting touch, a hand massage, a back rub, if appropriate and welcomed. It's about creating a supportive environment tailored to the specific deficit.
And communication. That seems critical across the board.
Absolutely essential. Face the person, speak clearly, maybe use gestures. For hearing impairment, be ready to write things down. For visual impairment, describe things. Identify yourself when you enter.
What about things like aphasia, or if someone has a breathing tube?
Then you need alternative methods. Picture boards, writing pads, maybe simple yes-no questions. Patience is key. Finding what works for that individual.
Right. What about in acute care, like hospitals? Things can get chaotic there.
Yeah, so orientation is vital. Tell the patient where they are, who you are, what's happening. Try to keep communication clear and consistent among the team.
Control the stimuli.
As much as possible. Minimize unnecessary noise and light. Maybe schedule quiet time. And safety first, clear pathways, call a bell within reach, sighted guide for walking if needed.
Okay. And then long-term, restorative care back home.
Maintaining a healthy lifestyle overall helps. Really understanding the sensory loss both the person and their family is crucial for adapting.
Combating isolation.
Yes, promoting social interaction is huge, especially for older adults. Finding ways to stay connected.
And practical self-care tips.
Things like the clock face method for meals, your potatoes are at 6 o'clock, adapting clothing, maybe Velcro instead of buttons, safety in the bathroom, exercises for balance if proprioception is affected. It's all about maximizing independence safely.
This has been incredibly insightful. A really thorough look at sensory alterations. If you had to boil it down, what's the main takeaway for everyone listening?
I think the main thing is that these alterations, deficit, deprivation, overload, are really common, and they can significantly impact someone's life. But, and this is the important part, with understanding, good assessment, and the right support, people absolutely can adapt and maintain their quality of life and independence.
Yeah, and remembering those 3 types and all the factors that play into it, age, environment, culture, it's complex.
It is, which is why that individual assessment involving the person and their support system is just so critical. There's no one-size-fits-all solution.
Absolutely. So a final thought for you, our listener. Considering how deeply our senses connect us to everything, what's maybe one small change you could make in your own space or how you interact with others, just to be a bit more mindful of sensory experiences, yours and theirs?
It's a great question to ponder.
And if you want to learn more, resources like the American Foundation for the Blind or the National Institute on Deafness and Other Communication Disorders are excellent places to start. Thank you so much for joining us for this deep dive.